Hi, this is Brian Kim. I'm going to share with you episode number 6 in the Surgical Instrument Review series. This is a Katena K1-5691. This is the double X speculum. And when you go on the website and go over the description, it says it's a parallel lid opening speculum for better access and minimal globe pressure. So this video is going to be a little bit different. It's going to show two cataract cases, but I'm going to be focusing more on the speculum aspect of the case. And so you can see here on the left side is our standard Lieberman style speculum, and on the right side is this double X speculum. So you can see as you're opening it, the blades open parallel, and it has that double X where the hinge is, and that's the reference to that description. Whereas on the left side, you can see it opens up not parallel, but from a single point of opening. So on the left side, it's more like a V opening, and on the right side, it's more like a U opening. Now, if you look at the blades themselves, the length of each blade is fairly similar, and so there's no much difference there. I do feel that the blade itself might be a little bit thinner profile on this double X one. You can see the blades a little bit flat. And again, you can see that double X configuration of the hinge. Go ahead and place it on the eye here very carefully. Irrigating the surface of the eye and putting some extra betadine. And then here we go with the case. So you're going to see I'm going to do my normal routine for the cataract surgery, but again, I'm focusing on the exposure. Again, I feel like the length of the blade is similar to the other Lieberman style blade. And obviously, as far as access for cataract surgery, this is temporal clear corneal cataract surgery. The main access issues are going to be really for the paracentesis incisions here. So far, I'm going to be scrutinizing and critiquing this speculum relative to what I've been using all along. And so far, I feel like it performs very similarly to what I've used in the past in my cases. I do have very good exposure of the eye as I'm doing the surgery. And, unfortunately, when it comes to these cases, you really have those unusual, challenging eyes that really pose the biggest problems. The really deep set eyes are really the biggest challenge. And unfortunately, you don't see those all the time. So it's really kind of difficult to really test the speculum in just a kind of routine eye situation. Essentially, it's performing like I would expect and how the other speculum that I normally use performs. So these are the Haldi-Burkhardt sharp tip forceps. You can see nice and well controlled, very little viscoelastic egress, no radializing of the tear as I'm making the rhexis here. This is a capsular fornix hydrodissection technique, placing the cannula contra-incisionally. Get a nice wave, decompress, and then spinning the lens there. And every time I don't know if I explained it in my previous cases, but it's kind of assumed, I want to make sure I have equal exposure of sclera on either side of the eye. And I will rotate the head either in Trendelenburg or reverse Trendelenburg, whatever it takes, so that I have equal amount of exposure of the sclera on either side of the speculum. And by doing it this way, you're really making sure that the eye is straight up and down relative to my microscope. And so that's kind of my reference point. Tilt the head up and down so that I get that even exposure of the sclera on either side of the limbus. That lid to limbus distance has to be the same on the right and the left sides. So you can see I've already initiated the double chop and removed that first quadrant. Spinning the lens, separating the second quadrant from the rest of the lens. getting around the lens piece with the chopper and then crushing it between the instruments, and then emulsifying the lens piece. Turning the second heminucleus in front of me, and then crushing the lens between the instruments. Performing the same maneuver on that third quadrant, lifting that piece up with some vacuum, and then using crushing forces to crush the lens piece into smaller pieces once again, and then emulsifying. So again, in this case, a very good exposure, no difficulty really with the surgical maneuvers. You can see the blade itself is tucked away, but the ends of the blades could potentially get in my way. And in some cases, with the old speculum that I've used, sometimes, again, depending upon the angle and the patient, sometimes my chopper might get in the way of the speculum there, the kind of the vertical component of the speculum. And, I'm trying to think about how that would be different from this one. And in that regard, I don't see that there would be much difference between this and the double X speculum. If somehow there was a way to make the speculum a thinner profile, instead of a rounded speculum, if it was flatter. However, of course, if it's flat like that, you'd be concerned how durable the speculum would be. But you can see for this case, really not much difficulty at all. The speculum is performing very well, giving me excellent exposure for the entire case. Remove all the cortical material and then polishing here. You can see I have tegaderm covering over the lashes. We're really compulsive about making sure the lashes are completely covered to prevent any of that mebum coming out into the surgical field and potentially getting in the eye. We want to avoid that. So far, the speculum is performing quite well. I'm not encountering any difficulty at all with the speculum getting in the way of any of the surgical maneuvers, especially since the paracentesis incision is between the vertical aspects of the speculum on either end. It's not really causing any problems. The only time that I've noticed any trouble is if my incision is going to be near actually the vertical components of the blades, which for cataract surgery is really not much of an issue. But if you're doing other cases, like when I'm doing my tube shunts, for example, I'm working in the paratemporal area, sometimes the blades can get in the way. So removing the viscoelastic from within the bag and underneath the lens, polishing here as well. You can see this is a pretty routine case. The lens disassembly went quite efficiently, using crushing forces to break down the lens into smaller pieces and using sparing amounts of ultrasonic energy. Used a corneal marker to help me size and center the rexus. You can see this is a perfectly centered and sized rexus here. Pushing BSS as I come out with the eye and a handpiece, and then I'm hydrogen my incisions. And this is the second and last case, putting the speculum in. This patient has some eye movements and a little bit of a Bell's reflex here, using the cotton tip to steady the eye, turning it down a little bit towards the right on the screen, and then using a corneal marker, which will help me to center and size the rexus. And then I want to make my incisions flat to the iris plane. Again, I have a nice exposure. And as I said, I like to turn the head up and down so that I have equal exposure. Again, the distance from the lid to the limbus, try to make it fairly even on either side. And that makes sure that the eye is straight up and down relative to the microscope. So again, so far, no major differences in the way this speculum performs compared to the Lieberman speculum that I've used in the past. Certainly not, inferior in any way. It's just it opens parallel, as you saw earlier in the video. It sounds like you would offer a theoretical advantage because it's providing parallel opening of the blade, but from a functional, practical standpoint, I'm not really seeing any major difference compared to with the Lieberman. You can see here I'm doing the Rexus now. There's a little bit of blood, so I'd stop and then proceed with the Rexus. Again, very well controlled, good access. I'm not having trouble getting to the eye at all. And this is the capsular fornix hydrodissection technique. Again, getting a nice wave. Gentle decompression on the left side, sweeping on the left, sweeping on the right. So it would be helpful if I use this speculum in different cases outside of the cataract cases. If I was doing it on DSECs and IOL exchanges, other types of procedures, I wonder if it would perform differently from the standard Lieberman speculum. So for a future video, that's something that I may do, is see how this speculum works relative to the Lieberman speculum in those cases. You can see there's a double chop and cross chop being performed, and that first quadrant comes out fairly easily here. Again, utilizing crushing forces to break the lens into smaller pieces, and then emulsifying with high vacuum. Pulling up that second quadrant up with the chopper and then crushing it and then removing the piece. Again, crushing the lens between the instruments. You can see excellent control with the maneuvers. And this technique is just kind of hassle-free, get to the point, crush the lens piece with the instruments. As long as you understand where you have your instruments and you have good dexterity using both hands together and just orienting the instruments around the lens piece so you can crush it, then it just makes it really a very easy way to disassemble the lens without any difficulty, really. So there's the last fragment, just crushing it and then using the vacuum to remove it, and then removing the epinucleus very carefully, keeping the chopper deep. Take the chopper out, push BSSN, take the fake tip out, and then I go in with the INA handpiece. I'm relieving some reverse pupillary block. You saw the pupil came down a little bit, and then I'm polishing again. So with regards to this double X speculum, again, is it superior to the Lieberman style speculum? I would say the answer is I don't know. As far as cataract surgery, I think it performed just as well as the Lieberman style speculum. Instead of opening in a V configuration, opening in a U configuration with the parallel opening of the blade. Again, not sure if it afforded any benefit because the length of each blade is the same between the two, and so that part really is the part that really gets in the way, that vertical component of the blade on either side. If it gets in the way of your maneuvers, then that could be a problem. Unless there's a way to get rid of that, I don't see how this is much different for just standard cataract surgery. Again, for temporal cataract surgery, the main incision obviously is not going to be encumbered by the speculum at all. It's going to really be your secondary incisions for your paracentesis incision and so forth. So if those incisions are going to be in the direction of each of the blades of the speculum, then I do think it can be an issue. But again, I don't think there's much difference between that portion of the speculum with this double X speculum versus the standard Lieberman that I was using. So if you ask me if you should invest in this speculum, I would say maybe. I think it depends upon the case. So far with the standard cataract surgery, I don't believe it offers any particular advantage, but it certainly didn't hurt using this speculum. I do think using it in a wider range of cases would be helpful, and then possibly in those deep set eyes, maybe it would provide some extra help, but that remains to be seen. I'd have to use the speculum a lot more than I've already used it. So this is my experience using the Katena XX Speculum K1-5691 on routine cataract surgeries. So I hope this was helpful to you, and I thank you for your attention.